I know we've got a lot of people that are out there putting a lot of licks in right now, and I'd like to go through and I'd like you to remember them in your thoughts, your prayers, as well as all the different people that we've lost and everything, and all their loved ones. But there's people that are out there right now, and they're really battling, and they're battling hard for all of us, and they're battling on the front lines, and these would be first responders, healthcare workers, long-term care workers, the National Guard, utility workers, the DOT that are plowing the snow, the convenience store workers, and all the other essential workers. And I know I'm missing people, I know that. But for crying out loud, you know that we care and we absolutely appreciate you. Now just think about just this, just 1 second. You got people out there that are battling the elements to try to get people, and get their vaccines in people's arms. You've got people that are sitting at home and they wish so much that they could be with their families and everything, and and that's really, really difficult to do right now. Our son Jay and his wife, were in Roanoke, a little ways away, and we surely didn't want them to come. Our daughter Jill lives right around the block from us, and she's always in and out of our house and everything, so we feel perfectly safe with Jill right there. But other than that, a lot of other people that are great friends, and surely our son and his beautiful wife, we've just not been able to be with today, and we hate it like crazy. On the other hand, there's a bunch of you that have really, truly lost loved ones that have been taken by this terrible killer. So all I can say is in every way, I appreciate so much that all the great work that all the people are doing all around me in every capacity. People that came out and got all this report together, and all the people that are with me here from my office, but as well as first and foremost, all the people that are really on the front lines. The people that are truly out there fighting this terrible, terrible disease. And they need to know all the time that we're right with them too. All of us, each and every one of us in West Virginia. They need to know that you're with them too. And so please at least be with them in your thoughts and your prayers. But if you see them out, no matter where it be, or you hear of them or whatever it may be, and you could send them a kind smile, or send them, a wonderful phone call, or absolutely if you're out going through, a drive-through and you saw one of them, going through as well as you, buy their lunch. Do anything and everything you can just to absolutely support them, because their courage is unmatched, and absolutely their devotion to each and every one of us is unbelievable. So I want you also to step back, and I know you're not going to do this because West Virginians, you're just the best, but don't anyone forget what the true meaning of Christmas is all about. It goes way, way, way beyond gifts and all that. But especially at this time of year, we're not going to make it through this without the help and the blessings of our good Lord. And so with all that, I would again wish you a great and heartfelt Merry, Merry, Merry Christmas. And now I'm going to do something that I hate to do worse than anything, and that is we've lost an additional 55 people in the state of West Virginia. It's even more reason why to come in today. With what's going on, if we would have waited and come in on Monday, you'd probably had over 100 people that would have died in West Virginia. It's tragic enough every other day. Our 1,194th death is an 80-year-old male from Jefferson County. Our 1,195th death, an 83-year-old female from Fayette County. Our 1,196th death, a 68-year-old male from Kanawha County. Our 1,197th death, a 90-year-old female from Hancock County. Our 1,198th death, a 73-year-old female from Pocahontas County. Our 1199th death, an 87-year-old female from Fayette County. Our 1200th death, a 56-year-old male from Ohio County. Our 1201st death, a 77-year-old female from Pocahontas County. Our 1202nd death, a 73-year-old male from Monongalia County. Our 1203rd death, an 81-year-old female from Summers County. Our 1204th death, a 46-year-old female from Kanawha County. Our 1205th death, a 77-year-old female from Pocahontas County. Our 1206th death, a 92-year-old female from Brooke County. Our 1207th death, a 79-year-old female from Pocahontas County. Our 1208th death, a 63-year-old male from Brooke County. Our 1209th death, a 90-year-old female from Brooke County. Our 1210th death, a 66-year-old male from Wyoming County. Our 1211th death, an 89-year-old male from Wood County. Our 1212th death, a 65-year-old male from Fayette County. Our 1213th death, an 80-year-old female from Hancock County. Our 1214th death, a 94-year-old female from Greenbrier County. Our 1215th death, an 88-year-old female from Monongalia County. Our 1216th death, a 95-year-old male from Hancock County. Our 1217th death, a 90-year-old male from Summers County. Our 1218th death, an 80-year-old male from, an 80-year-old female from Randolph County. Our 1219th death, an 81-year-old male from Hancock County. Our 1220th death, an 89-year-old female from Hancock County. Our 1221st death, an 85-year-old male from Kanawha County. Our 1222nd death, a 79-year-old male from Taylor County. Our 1223rd death, a 62-year-old female from Hancock County. Our 1224th death, a 90-year-old female from Putnam County. Our 1225th death, an 84-year-old female from Greenbrier County. Our 1226th death, a 93-year-old female from Ohio County. Our 1227th death, a 75-year-old female from Kanawha County. Our 1228th death, a 67-year-old male from Marshall County. Our 1229th death, a 70-year-old male from Barber County. Our 1230th death, a 73-year-old male from Preston County. Our 1231st death, a 78-year-old female from Marion County. Our 1232nd death, a 70-year-old female from Hancock County. Our 1233rd death, an 85-year-old female from Hancock County. Our 1234th death, a 68-year-old male from Cabell County. Our 1235th death, a 68-year-old male from Kanawha County. Our 1236th death, a 77-year-old female from Mason County. Brian, you know. Our 1237th death, a 92-year-old female from Boone County. Our 1238th death, an 84-year-old male from Mineral County. Our 1239th death, an 87-year-old female from Marion County. Our 1240th death, an 84-year-old female from Hancock County. Our 1241st death, an 85-year-old male from Kanawha County. Our 1242nd death, an 86-year-old female from Greenbrier County. Our 1243rd death, a 63-year-old female from Raleigh County. Our 1244th death, a 91-year-old male from Berkeley County. Our 1245th death, a 51-year-old male from Berkeley County. Our 1246th death, a 65-year-old female from Berkeley County. And our 1247th death, an 86-year-old female from Randolph County. 55 great West Virginians. It's not good, not good. We've had 1,597 new positive cases in the last 24 hours. Our daily positivity rate's 8%. Our cumulative rate is now at 4.54%. We have almost 24,000 active cases and recovered cases of almost 54,000. We have 702 hospitalized in West Virginia and 181 patients in the ICU units. I think those are down just a little bit. It's still terrible. We tested 13,500 people in West Virginia yesterday, and our reproduction RT number now is at 1.19. It is the second worst in the entire country. We have 49 counties in our state that are either red or orange. Again, I tell you just this, and I tell you this from the deepest parts of my heart. I say to you over and over and over, if you're 65 years of age, we know who this disease attacks. And absolutely, if you get the least bit of a cold or headache or tiredness, unusual tiredness or whatever, please go get tested. We can give you antibodies right now if we catch this in the first 2 or 3 days, or absolutely in days under 6. We can catch this, and absolutely, if we catch it, we can stop it. But if you absolutely just wait around thinking this is a cold or just a bad headache or something like that, the odds are when it's time to go to the hospital and everything, or when it's time to go get tested and everything, it'll be too late in lots of ways. So absolutely, please just go get tested on the first feelings of, just not feeling the same or not feeling right. Go get tested. Run to the fire almost as if you were having a heart attack or a stroke. Please do. And we can absolutely catch this and we can stop it. West Virginia continues to lead the nation in getting our vaccines out. As of today, we have now stuck people in the arms with 28,623 doses that have been administered. We have 60,000 doses of vaccine in West Virginia right now. And according to Bloomberg, West Virginia still has the highest administration rate of any state in the country. The next closest state to us, we are now, with the 60,000 doses that we have here, we are now at 47.01, and the closest state to us is Maine with 28%. West Virginia is doing a great job there, and that's all tribute to our healthcare people and all our great work by our National Guard. Just keep it up, everybody, and that's why so much I want your prayers today, Christmas Day, because they're out there. They want to be with their families. They're out there, and they're working so hard for all of us. By this Monday, by the past Monday, we have gotten out vaccines to 100% of our health departments, 100% of our long-term care facilities, and nearly all of our acute care hospitals, or nearly all of our acute care hospitals' healthcare workers will be completed in the next 3 weeks. Now we've taken on a little bit different twist. Now we're taking on vaccinating the people that are given the vaccines or the vaccinators. Over 10,000 West Virginia, including primary care providers, rural health clinics, free clinics, home health, hospice providers, urgent cares, and federally qualified health centers will receive these vaccines this week, on top of all the great work that we're doing at our long-term care facilities. And by focusing on these people, we can keep the engine running to where we can take care of our people. I couldn't tell you how important it is today that we focus on, first and foremost, age. Second of all, we focus on the fact that if you are of age and you get this and you get a test, we can quickly get you an antibody. And thirdly, we want to get into being able to really aggressively test the people that are 18 to 35 years of age. As I've already said, West Virginia is leading the nation in the administration of getting the vaccines in people's arms. Right now, we are also leading the nation in getting all of our nursing homes and assisted living facilities vaccinated. We're very, very hopeful to have that achieved by the 28th of the month. We should be complete by Monday, and that means that we will have offered vaccines to all 214 facilities in our state. Before some other states get out of the blocks and even start giving people vaccinations and everything, I hope from the standpoint of our long-term care and our nursing homes will be done. To do this, we are estimating that we will deliver 12,000 doses every day this coming week. And again, we're partnering. One of the big keys was partnering with all the pharmacies and everything to be able to use them as our frontline defense as well. I remind everybody again over and over and over about your vaccines and everything from the standpoint of you have to take 2 doses. On the Pfizer vaccine, it was 21 days apart. On the Moderna, it's 28 days apart. You cannot cross mingle. It's got to be Pfizer or Moderna. And the other thing is absolutely without any question, you cannot catch COVID from the vaccine. Quit coming up with silly reasons to not take the vaccine. This vaccine is supposedly safe beyond belief. I've taken it. I feel great. Absolutely, just please take the vaccine when it becomes available to you. I think Dr. Amjad, is on the phone. She spoke to this the other day, but in regard to the antibodies and everything, one of the great big plays that we've made in this is just this. Instead of just having the antibodies at the hospitals, we want the antibodies where we can do you the fastest and the most good, and hours mean something, not days. In other words, if we test you positive and you've had symptoms for 4 days, we got hours. We don't have weeks to get these antibodies to you. So we've moved towards getting them in our assisted living, in our nursing homes, in our local pharmacies, and lots of different places to where we can get this to you really quick. Right now we have 1,400 doses on hand in West Virginia. And there's 600 more of those doses that are on the way to us right now. Over and over, I've told you many, many times, that you could look on your website and you can see, our places for free testing and where our drive-through pharmacies are still doing great work for us in every way. And the only other things I would tell you is just this. We're not going to have a Saturday map and everything. We're not going to update any more about our schools, on this week and everything. But the updated map, is what it is right there. And I can tell you we've had, as I told you, when I was in here on Wednesday, we had 11 current outbreaks in our schools and 49 confirmed cases. And that was fabulous. It's a fabulous number. I know we aren't in school, but at the same time, our schools have done an incredible job. And hats off to all the health officials and the National Guard and, all the sanitization work. Hats off to the teachers and the service personnel. Hats off to all the students and all the administrators, all the school superintendents, and all the people that are doing great work there. Our long-term care facilities, as of today, we have 111 outbreaks in our long-term care facilities. We have 17 outbreaks in our churches in 15 counties. Those are Braxton, Greenbrier, Harrison, Jackson, Lewis, Marion, McDowell, Mineral, Mingo, Monongahela, Nicholas, Raleigh, Summers, Webster, and Wyoming counties. Always tell you to keep a pew in between you if you go to church. If you're 65 and above, I would plead with you to think really hard about getting your church services online or just skip just a little while. We're really close to being able to get a vaccine to you and absolutely really just cripple this terrible killer. But But if you opt to go, please do keep a pew in between you and wear your mask and wash your hands and do all the proper guidelines that we've told you about over and over and over. There's 265 active inmate cases now. We have 80 at the Eastern Regional Jail, 76 at St. Mary's, 51 at the Central Regional Jail, and 25 at Taggart Valley. You know, corrections is still retesting, inmates, doing incredible work, and I just salute them over and over and over. Great job, everybody. As far as wearing your face mask, gosh, I feel like I'm beating a dead horse, but for crying out loud, in many ways, this is still our only defense. It's our only defense other than the vaccine or shutting everything in the world down, and we really can't pinpoint where that would do us good. And so please wear your mask, please. Get your flu vaccine and try, if you could, especially if you've had this dreaded disease, to give blood. Blood and plasma will really save lives. I'm going to pass at this time to the experts on, please.
All right, thank you, Governor. Let's now go to Major General Hoyer with the West Virginia National Guard.
Good afternoon. On behalf of the 6,400 Guardsmen and their families, Merry Christmas and Happy Holidays to all. As the Governor pointed out, we've made significant progress in our vaccine distribution efforts. Of the 44,300 doses that we received by late Tuesday, we have already today distributed 35,170 of those in preparation for actual administration. The balance of those are already scheduled, and we will do just-in-time deliveries over the next couple of days as the administration is ready to go. So we are continuing to make good progress. As the Governor said, 28,623 have been administered. We will be focusing the rest of this week as well as next week on continuing to build that network infrastructure and those partnerships that the Governor laid out that we need to have the appropriate foundation to distribute even more vaccines. Our focus continues to be vaccine distribution to reduce death, reduce hospitalization, protect our most vulnerable, and maintain acute critical services and acute care services. And again, our focus will be, and the Governor has given us the focus of being as efficient as possible, as you've heard him say, quick but don't hurry. You've heard me talk about deliberate speed, but be in a position where we are pressing the federal government to send us more vaccines to distribute, because we are distributing at the appropriate pace. Thank you.
Thank you, General. Next to Dr. Clay Marsh, our coronavirus czar.
Well, good afternoon. I want to wish everybody a Merry Christmas and Happy Hanukkah, Happy Kwanzaa, whatever you celebrate. In this day and time of hope and blessings, it's good for us to look toward what we're grateful for. And for me, I'm grateful for so many things. Certainly my family, my faith, the Governor's leadership, our great team that I'm having the privilege to serve with, all the people, as the Governor said, who are serving others today in whatever way they're doing that. Certainly, I'm so proud of our healthcare workers, since that is sort of where I come from. But for everybody who's out there, thank you for your incredible service. You know, many times it might appear that as a group, or maybe for me personally, that we're harping on how many problems we have. And that is true. We do have some challenges today, and the Governor has outlined many of the challenges that we face acutely. We're certainly concerned about the transmission of COVID-19, the position that West Virginia's in as a vulnerable state, and certainly as we look at our hospital numbers, we want to pay particular attention to trying to maintain that capacity and capability. But I think that we should also recognize how lucky we are to live in a state with such incredible people, as the Governor has said, who are very smart, very innovative. we are really leading the way, not because of any grand scheme, it's because of the action of each one of you. And as we start to look at where West Virginia is going to be in the future, we see West Virginia shining brightly today. We see this as the start of West Virginia becoming a beacon for others. And we know that during this time, the critical actions of each person in West Virginia will determine what happens in our state in the next 2 weeks to 4 weeks, in the next month or so. So we know that the goodness, the service, the altruism, the love for family, for community, for neighbor really does take precedence in our state. And we really trust and hope that this message really hits home with each one of you, not to harp or tell anybody what to do, but to ask each other to support our state, to support the health of our people, because pretty soon COVID will be in our rear view mirror, but the legacy that each one of you are helping us write today will not be. It'll be in front of us. And so I'm very grateful for each of you and for the opportunity to serve. Thank you so much.
Thank you, Dr. Marsh. Next to Dr. Ayn Amjad, our State Health Officer.
Good afternoon. I do want to wish everyone a Merry Christmas and Happy Holidays as well, and thank everyone who is working today out there. I do know it's very hard not to be able to spend it with your families, and I do know as a healthcare worker that I normally have to work as well, but I do want to share that it is very hard. And if you are with your families today, to enjoy this time and to remember that if you are with multiple family members today, that if it's not your normal household, to do spend it safely and wisely, to wear your masks if it's not your normal household members. And there are ways to do it safely. If you're going to share a meal together and it's not your normal household, to maybe sit apart, 6 feet apart is the recommended way to do it, and to put your mask on if that's the case. And that, you know, if you do feel bad after that time, there are ways to get tested afterwards. But, you know, it is a time to share it with family and with your loved ones. And we do want to remind people that, you know, there are ways that you can find testing sites afterwards. We have those sites up on our DHHR website, but to take this time to be with your family, your loved ones. But we also want to remind everyone that COVID is still out there. We do have a vaccine that's available. We are looking forward to having that available to the public, but we do want to remind everyone to still wear your masks when you're out there in public and to limit gatherings as much as possible. But hope everyone has a good time with their family members over the next few holiday days coming up ahead. Thank you.
Thank you, Dr. Amjad. And finally, to Secretary Bill Crouch with the West Virginia DHHR.
Good afternoon, everyone. As the governor mentioned, long-term care facilities have been our priority. The governor began making the elderly a priority early in this pandemic back in April. I want to make sure everyone understands our state long-term care facilities are also falling under the same vaccination protocols as the other long-term care facilities in the state. 3 of our 4 have already gone through the vaccinations. That's Hopemont, Jackie Withrow, and John Manchin hospitals. We have Lakin Hospital that will begin their vaccinations on Monday and will complete the long-term care facilities for the state. So rest assured, we're following the same protocols. With that, I just want to thank the governor for his leadership. This is a trying time in the history of this state, and we have had strong leadership that has put us in the forefront of this pandemic throughout the last 9 or 10 months. I also want to thank this team here. Gosh, it's a privilege to be with these folks, and I'm just so proud of what everyone has done. I really want to thank our frontline folks. DHHR has stepped up. We have staff working today. We have staff working every day. pandemics don't stop for holidays, and we still have outbreaks. We have individuals that need to do those investigations and need to make sure that we do the work that needs to be done to keep that spread down and try to keep people as safe as possible. So I want to thank the frontline people at the local health departments. Again, DHHRs, we have a great number of people working today, but also our state hospitals and our community hospitals throughout the state. They go back into those buildings every day, whether they have COVID patients or not. They, as the governor says, run to the fire daily. So I thank them so much for what they do. Again, thank you all for what you're doing, wearing masks and trying to keep yourself, your family, and your neighbors safe. So thank you, and Merry Christmas to everyone.
Thank you, Secretary. Governor, back to you.
Well, first of all, let me say this. I appreciate the kind words that people are saying about me. That's great. But really and truly, let's just be real. It's my job, and it's an honor to be here and to lead you. It really, truly is. And I'm going to do my job. But the thanks really needs to go to all these great experts for all the great work that they've done. But more so than that, it needs to go to all the people that are out there, all the people that crawl out of bed each and every day knowing that they're going right into the fire. And yet they do it. And they do it for all of us. And then there's real live thanks that needs to go to all the people of this great state. You have become the envy of our nation, as I've said over and over and over. You can't imagine the national broadcasts that want to talk about what have you done in West Virginia? What's going on in West Virginia? Why wasn't it done in other states like it was done in West Virginia? Of all places, West Virginia. We've known how great West Virginians are. The world hadn't, but the world's seen us. The world's seen us when we've really been tested right here. You've done really great stuff. Now, today's Christmas. To me, argumentative maybe with Easter, but no other holiday that could even approach the importance of to any other holiday that Christmas is to all of us. With all that being said, again, I wish you the merriest of all Christmases. I came down today and Baby Dog rode with me. And I truly believe that the good Lord gave you the ability to smile and to laugh. And so on this Christmas, as I wish you a Merry Christmas, I want to show you my traveling companion today. And she absolutely, along with me, wish you the merriest of all Christmases. She's a good little girl. She's gotten a little big. She's a little bit kind of like me, but she's had a little bit too much Christmas extras, I'd say. But anyway, nevertheless, for the both of us, for Kathy and I, for all of our family, we love you. We love you with all of our soul. And just remember this, as I said before, the good Lord gave you that ability to smile and to laugh. I know things are really, really tough for so many. We're with you. You're not alone. You're going to get through this. We're all going to get through this. God bless each and every one of you. And for Baby Doll, who's giving everybody now a high five, God bless you in each and every way. Thank you so much.